Time now for our program, Let's Talk Health. In this program, we have the topic National Eye Donation Fortnight, a gift beyond life. Some gifts are wrapped in a beautiful paper. Some are offered with smile. But there are gifts so precious that they continue to give long after we have left the world. Yet, for millions, the world remains hidden behind a curtain of darkness. National Eye Donation Fortnight is more than an awareness campaign. It is a reminder of our ability to make a difference in another person's life through an act of compassion that cost us nothing, yet can mean everything to someone else. It invites us to look beyond the boundaries of our lives and think about the lives that may continue by our generosity. Because sometimes, even when our journey comes to an end, our ability to bring light into the life of someone else does not have to end with us. In today's program, we explore the meaning of science, significance, and human spirit behind eye donation. And to guide us through this important conversation, we have accomplished medical professional Dr. Phinrikerbha, SRD ophthalmologist. Dr. Blah, thank you for giving us this opportunity and for joining us in our program.
Yes, welcome.
A program where she will share her professional insight and help us understand donation from a medical as well as a human perspective. So today, as we begin our program, let us remember a simple yet a profound thought. When we give sight, we do not merely give someone the ability to see. We give color, possibilities, independence, memories, and perhaps a new way of experiencing life. The National Eye Donation Fortnight let us open our eyes to the possibility of giving someone else chance to see. With that note to begin with, Doctor, could you kindly explain to our listeners what eye donation actually means and why it is such an important social cause?
So what eye donation means is that it is a voluntary act of giving your eyes after your death to another patient who is suffering from corneal blindness. And when I mean corneal blindness, it means those individuals that are blind because of cornea-related disorders and not because of any other ocular disorders. So I will just name a few of the cornea-related disorders that you can understand. For example, if a patient is having severe corneal dystrophies, severe corneal opacities, where the cornea blocks the light to enter the eyes, that in those conditions, the patient is blind because of that cause. So these patients will benefit from a corneal transplant. Those patients who have severe infective or severe non-infective keratitis causing corneal perforation, patients who have keratoconus will benefit from a corneal transplant. So to answer your second question as to why it's such a noble social cause is, first of all, these corneas cannot be artificially made. So this is a very noble and life-changing act to give your eyes to someone so as to prevent someone from having this complete blindness, because this is a curable and treatable type of blindness. So understanding the process, understanding the facts about eye donation will encourage more people to take part in this noble endeavor, and it will help to combat the myths relating to eye donation that are still happening till today, and all the other to overcome the social and the cultural norms that we are still facing about eye donation.
Okay. Yes, no doubt that is very informative. But when we talk about eye donation, which part of the eye? Is it the entire eye, the cornea, or the parts of the eye?
So when it comes to eye donation, only the cornea, that is the transparent part of the eye that reflects the light, that is taken for the purpose of transplantation. No other part of the eye is used for the transplantation. However, if a person wants to donate his entire eyeball, he can also do so, but that will be used for the purpose of academics and for education, not for the purpose of transplantation.
Oh, acha. That there is a difference there. So it can be given, but then it will be used for the students.
Yes.
Do you think that the gift of an eye can transform the life of a person?
Definitely, it will transform, because the patient who is blind can see again. So this can boost up his confidence again, and he can become independent once again when he regains his sight. So definitely, it is life-changing for that person.
And when we talk about it, the common question which anyone would say, that who can donate the eyes?
So there's no restriction as to who can donate. Anyone and everyone can donate their eyes, from an infant to an elderly person. Everyone, there's no age limit for eye donation. But there are certain conditions, there are certain specific medical conditions and ocular conditions where the transplanted tissue will not be able to use for the purpose of transplantation. For example, if the patient is having ocular disorders like advanced glaucoma, if the patient is having severe corneal opacities, that cornea will not be able to be used for the purpose of transplantation. And also, if the patient has certain medical conditions, like if a patient is living with HIV, if the patient is suffering from hepatitis B or C or septicemia, in those cases also, those corneas will not be used for the purpose of transplantation. But if the patient wishes to donate, he can do so. That again can be used for academic purposes.
Okay, this is a new information, that it can be used for academic purposes. Even that is helpful, I think.
Yes,
because it's very difficult for a student, to get these in a live hand-in experiment.
Yes.
People like me with spectacles or common eye conditions, of course, you have mentioned. But then, what about spectacles?
Yes. Anyone can donate their eyes, even those with spectacles, with high power also can donate their eyes, as long as the cornea is healthy.
So, if the cornea is healthy and if I have a spectacle, no problem?
Yes, there's no problem at all.
What is the age bar then?
There's no age limit. Anyone can
So now if I
eyes.
want to, and we have the procedure, of course, we'll come to that. Okay, let's move on to, as you said, there can be only special medical conditions that may prevent a person from becoming an eye donor. But is the procedure very easy? Because a person who has never formally pledged their eyes during their lifetime, can that person become a donor for after death?
Yes, suppose if a person during his lifetime has never pledged for an eye donation, after his death, his family members have the authority to decide for him. They have the right to decide for him whether they are willing to use the diseased eye for the purpose of eye donation. So here comes the importance of the family's decision in that case. Even if a person has pledged his eyes during his lifetime, but after his death, if the family members do not agree for the donation, again, it will
also
cannot be used. There will be a problem.
But I think what I want mainly is, because suppose after my death someone wants, it has to be very fast. I heard that because the time span is very less, I think.
Yes. So after the death of the deceased person, the family members must contact the nearest eye bank within a period, as soon as possible, because the tissue must be retrieved within a period of 4 to 6 hours.
Right, okay. As you mentioned, 4 to 5 hours. And so what I experienced from my personal thing is there's a card given, I think.
Yes.
They have a card, and that card must be kept with the people, your near and dear ones, always in handy, so that in case anything happens, this has to be done. But suppose I register somewhere and I die somewhere, so what happens?
So we have this online portal. We have an online and offline portal. If you wish to pledge for your eye to be donated, you can go to this portal which is called the NOTTO, which stands for National Organ Tissue Transplant Organization. So here it's just an online portal. You go to it and fill all their details, and you will get this digital pledge card, this digital donor pledge card. You can keep with you, or you can keep with your family members, and you will receive phone numbers, contact numbers of the nearest authorized eye banks. So if you wish to contact if the family members wish to contact after the death of the person, they can use those. You can display the donor card, and you can contact them, the authorized people. And if you do not wish to go to the online portal, you can also fill an offline form by contacting the nearest eye bank.
So basically, doctor, what I'm talking is and what you have explained. The thing is that suppose I have made the online portal, I must disclose it to the family members, because it's not written that I die where I pledged it in Shillong, and then somehow my death occurred in Chennai. And then they must be aware of it, to take an immediate step. So that can be done since we have this online portal. Okay. Another thing is, and I have seen, how fast do this action happen after I call them? Is it, do they respond immediately?
Yes, they respond immediately. It's a very fast process.
And they come and within few minutes, because in my personal experience, I have seen it, that they came within a short span. And very fast they had removed it. Okay. Doctor, just for simple people like us, could you explain to us in a simple term what happens to the donated cornea after it reaches an eye bank?
So I'll just explain from the start how it happens. Like suppose if the person has been deceased, the family members have called the local eye bank. So the trained medical professionals, the trained ophthalmologists will come in an ambulance and then will retrieve the transplant. This is just the corneoscleral rim, what we call, in complete sterile precautions. Or otherwise, if the patient wants to donate his entire eyeball, we can also perform an enucleation procedure for that matter. And this process takes just a maximum time of about 20 minutes. So it's a very fast process. And after that, these tissues are kept in a sterile vial, which contains some preservative material, which is called the McGarry-Kaufman medium. So we keep in that vial and we preserve it, and we then keep the vials in the cold chain so as to maintain a low temperature of the tissues, not allowing them to freeze. So after keeping this cold chain, then this box is then transported to the eye bank, and this is for the purpose of lab evaluation of the tissues. In an eye bank, these trained lab technicians then will evaluate the quality of the cornea, the clarity, by using specular microscopies, by using slit lamp microscopies. And then once everything is cleared, then these tissues can then be sent to the transplant centers. And another important thing is that while retrieving the eye, we also take out blood samples from the deceased person, because again, we have to screen for those diseases like I've mentioned earlier, hepatitis C, hepatitis B. If the patient is unknown, that if the family members have no idea that he's suffering from such disorders, have never diagnosed his entire life, we still screen for such disorders prior to transplanting.
That means only after it reaches the eye bank and the lab technicians does the thorough study and the blood reports come, then it's segregated for different purposes, whichever purposes it is supposed to be taken for, right? Another common question which happens to the people who are the kith and the kin of the person who is deceased. Is eye donation safe for the donor's family? Can the donation affect the appearance of the deceased person? And the common misconception is that donating one eye means that the donor will be unable to have a dignified funeral. What would you say to families who have this concern?
So yes, definitely a lot of families have this concern that, donating eyes means it will cause a permanent disfigurement of the face of the eyes. But these theories are completely false. They're just myths, because actually once we take out the eye or whatever tissue, we place a material inside the eye which is called the scleral shell. It's an acrylic material. So that shell will maintain the contour of the eyelids. It will preserve the architecture of the eyes, and we also suture the two eyelids together so that the eyes eyes do not open up after that. So it will cause no permanent, no scar, nothing like that. It will appear as if they are normal eyes. So, and as this procedure takes only about 20 minutes, so it will also not delay any funeral plans that the family members are preparing.
As you mentioned, because I would verify it, because I had the experience in this age of mine, and I consider it to be a lifetime experience.
Yes.
Because it happened in my family itself, and they came within a very short span of time, and then they did it.
Yes.
And I personally was I have never seen it. I heard about it, but I've never seen it.
Yes.
So I was observing that what exactly is going to happen, and I find it's just what you said. No,
Yes.
of course they had just put a cover,
Yes.
but they left it in our discretion whether we wanted to open it or not.
Yes.
But immediately they had just covered it. So I found that it's just the same.
Yes.
And you also spoke about the segregation part, matching the recipient. So can you a little bit highlight about how it is matched with the recipient and etc.?
So actually, this is a very simple procedure. There's no matching that is required. When we talk about blood matching, we have these blood group cross-matching when we have to transfuse blood from one person to another. But the good thing or the best thing is about cornea transplant is that there's no absolute cross-matching that is to be done. Any person and anyone with a healthy cornea can directly donate his eyes to we can easily transplant the cornea to another individual without having to do a cross-matching.
Ma'am, how do you see the ratio? Is it in good amount? This kind of donation is happening now? I feel it's not, but
no, it's actually not. Especially like, for example, in Meghalaya, we still do not have an eye bank. We do not have these transplant centers. So again, especially in the northeastern states, the ratio is very less as compared to the southern parts of India and the western parts of India.
Okay, we'll come back to that, because I want to clarify one more myth, that elderly people cannot donate their eyes.
No, that's just a misconception. As I've mentioned earlier, there's no age limit. Anyone and everyone can donate their eyes.
A person who had cataract operation?
That those persons can also donate their eyes, because we're not
that's
utilizing
real information today.
Utilizing just the cornea.
Okay.
Yeah.
No, because these are common things. Oh, how can I do it?
Yes,
Because I've
most
got.
people
How
don't
can I
know.
do it? I have this.
Yes.
What are the common myths you all find, doctor, that which is not encouraging people? Because I don't see it happening, because you see, I'm not a kid now. So in my lifetime, if I've seen only one person happening in front of my eyes, so the ratio is very, 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 very meager. So what exactly the hindrance from your end you all are seeing?
The hindrance most commonly is because of these myths that patients or that family members have, that it will cause a disfigurement of the face. But as I've mentioned earlier, there's no type of disfigurement that can occur to the face or to the eyes. So that can be ruled out. And then next is these religious beliefs that people have, that that religion is also against this eye donation, but that is completely false. It is actually considered as it's a very noble cause, and it's a gift to humanity, to give the gift of sight to someone else. So you should not consider that the religion will be a hindrance to this eye donation. Another thing is that most people think that that they would have to bear some cost for eye donation, for the doctors to come to their house and perform this procedure. But no, this is absolutely free of cost. So everyone should understand that this process is a very simple process, no cost to be borne by anyone, and it's a very life-changing and is a noble act to be done. So try to understand that these, to prevent all these misconceptions that are still happening around us regarding eye donation.
Coming to this concept only, ma'am, taking in the larger context, not only in Meghalaya, is it the same condition? Are we facing the same problem?
So actually, even when we speak of the entire country, what we receive annually is an estimate of about 50,000 to 60,000 tissues, but the actual requirement is about 250,000. So still India is still facing a deficit when it comes to eye donation, and very much in the northeastern states, because most of the eye banks, even if they're present, they are non-functional, and very few eye banks are present. Like even in Meghalaya, we do not have an eye bank. So the nearest eye bank for us would be in Guwahati. So that also will be a hindrance.
Well, we'll do a quick thing. The person who has pledged and now has left it with the family, how fast should the family take the steps so that his pledge is respected?
How fast the family should take the steps, meaning how fast?
To call the person, it should be very fast, I
yes,
think.
As soon as possible. As soon as the doctor has confirmed that the patient is deceased, that is the window period, that is the time where the family members should contact the nearest authorized eye bank.
Now, suppose someone who is listening to us today and who wishes to pledge their eyes today, what is the first step they should do?
First step is, as I've mentioned earlier, again going to the online portal, either online or offline. So again, filling out the portal and receiving the donor card. That is the first step. And the second step is to inform your family members about your decision, because they will be the ones who will make an informed consent for you once you have passed away.
So suppose I want to do it. What will be the first thing? I want
go
to
to
donate.
The online. You want to donate. You're still alive. You go to the online portal and fill out the form. Then you will get a pledge card.
On just what do I type there then?
The website is available in that online portal, which is NOTTO, as I've mentioned earlier, the National Organ Tissue Transplant Organization.
Once again, NOTTO. Let's make it very clear. So if any one of us would like to do it, we need to go to this portal, and then the rest will follow accordingly. What do you think the schools, colleges, or the workplaces or the community can do in this?
So schools, colleges and the communities, they can play a huge role in public awareness about eye donation, because they can arrange the medical health camps, they can arrange expert talks, even they can conduct flash mobs regarding eye donation, or street plays regarding eye donation in their local festivals, in their school or college festivals. So by just doing these simple acts, it can help to educate the public, help to educate the children about this process of eye donation. We can also run social media drives about eye donation, because everyone is into social media in today's world, so they can do so to educate the public.
Beyond that, ma'am, one question which is just coming as I'm listening to you: how can we set up or take a step to set up something like this in Meghalaya? Is it very tough?
To set up an eye bank, it's not tough, but we need to encourage more people, because even if we have an eye bank, if there are few donors, if people who do not come up to pledge, so that eye bank will remain non-functional. So the first step is for us the individuals to pledge our eyes now by going through the online portal. After that, then maybe we can think about setting up an eye bank or transplant centers.
So what you mean to say is, first we must get people who are ready to pledge. That mission is more important than setting up an eye bank.
That is also important.
Yes, but only after we have seen a collection of people, at least, say in Meghalaya, if you take the state of Meghalaya, that we find a collection. So what do you, because this is something which is very fascinating and we have not done it, and I think we really need it now.
Yes, we really
so
need it, I feel.
How do we go about it, doctor? Can we just think, how can we all can from the department of yours and all that go to the different organization and start? Because there are many NGOs, many healthcare centers, or many private NGOs or clubs, or they are doing many kind of programs. So if they take it up,
Yes, I think if the NGOs, if the the health communities, they take up this step, even most people will find it difficult to go to the online. But if we can provide even offline pledge forms for the people, we can definitely create, increase the number of people who want to donate their eyes by spreading awareness, by spreading education towards to the general public. So only after that, then yes, then we can definitely have an eye bank in our state also. And eye bank is not a complicated creating an eye bank is not a complicated thing. It just requires a room and all these preservative materials.
So huge steps can be taken in the state of Meghalaya if you want to, because what is the ratio here, madam, regarding blindness in Meghalaya or in the Northeast in general?
So actually what I've seen in my practice as of today, the most common causes of preventable blindness in Meghalaya are because of the cataract. Not so common. These corneal blindness are not so common in Meghalaya as such, as compared to other rural populations in the country. So I guess this will be an ongoing process. We'll have to detect as eye care professionals. We'll also have to detect patients who have blindness because of cornea-related disorders.
So beyond cornea-related disorders, they cannot be given sight?
No, if patient is suffering blindness due to other causes involving the other parts of the eye, those will not benefit from a corneal transplant. Only patients with corneal disorders.
That if the ratio is less comparatively in the Northeast, then but can from here go to other state?
They can, but again, the time is crucial, right? If a person is living in Meghalaya and wants to donate his eyes now, the nearest eye bank is in Guwahati. So again, it will take a lot of time for the people from Guwahati to come and retrieve the eyes of the patient, unless the patient is staying somewhere close by the eye bank.
Yeah, that is true. No, I'm saying, doctor, it's just because of my inquisitiveness that suppose we have an eye bank here. Okay, we don't have this problem much. Here also people are going to get it. But suppose someone needs it in say, Bangalore, and they don't have the stock. Can it be taken, transported from here to Bangalore and done?
Yes, of course.
That can be done.
Yes, can be done. Yes.
Okay. So it's not that it's going on a waste.
No.
It's never going on a waste, no?
Yes.
So even if we are blessed that we don't have this here much, but then we will be a blessing to someone else somewhere down the line.
Definitely.
Right? Another question which hits me is that this particular fact of eye donation, whatever thing, doesn't it come automatic? How can it be automatically created in the mind? So we have understood that myths has to be removed from us, that fear has to be removed from us, because today I may not have someone, God forbid, in amongst us, but tomorrow it may happen to any one of us, right? So what about just going a little off track? What about the whole body, donation? What is the procedure? Is the procedure the same, or that is also an online
donation,
portal?
Yes, the same portal, the one, the NOTTO that I've mentioned, the same portal where you can donate any part of your organ also after your death.
What else, doctor, would you like to share with us?
So my message to the listeners here is that this eye donation is a gift of light to anyone who is blind, because it's like an act of kindness, because giving your eyes to someone who is blind will transform the life of that individual forever. And one eye donor can help 2 blind people see. So that is also very life-changing and a great deal.
I just want to add, I didn't get you. One donor. Yeah, can give eyes to 2 people.
Yes.
Because of the 2 corneas, right?
Yes.
Okay. It didn't strike me. There's another thing coming to my mind. It's a little science-based. If corneas do not contain blood vessels, then how do they receive oxygen?
Corneas do not contain blood vessels. Corneas definitely receive oxygen. We have so many cells, epithelial cells. We have tight junctions. The cornea has around 5 layers, and it's densely packed by nerves and epithelial cells, tight junctions, and pumps that will help to maintain the corneal hydration. So even though it's devoid of blood vessels, it definitely receives the oxygen from the structure that it has.
Okay, I just want to ask, why do you call cornea the window of the eye?
It's the window of the eye because it's the first transparent structure which is present in the eye that first refracts the light rays which are coming from a distance. The second refracting part of the eye is the lens which is present inside the eye. So that is why it is the window. It's like a window or the camera of the eye, the cornea.
So if a layman asks you, you are taking out the black part or the white part, they'll ask you.
Most people, they might think that the cornea is the black part of the eye. That is not true because it's transparent. What people see is the iris, which is present, the pigmented part of the eye, which is present inside the cornea. So that they think that is the black part, but cornea is not actually the black part of the eye. It's the transparent part of the eye.
Okay. Can this corneal tissue be stored before transplantation?
Yes, definitely. Those preservative media that I've mentioned, they can definitely store them. So actually there are various preservative media. So if you want to store for just a period of 2 to 3 days, we can use this Macquarie-Kaufman medium. If you want to store the cornea for more than a week, for 10 days, up to 15 days, we can use these preservative media which are known as the K-sol, the Optisol, Dexol media. If you want to preserve it for months, we can use organ cell culture. And if we want to preserve it for a year, we can use the cryopreservation. So these are the various methods where we can preserve the eyes depending upon how much.
Okay, I was just about to ask you that, what is the modern method, technology you're using now to, store or improve the procedure of corneal transplantation?
What is most commonly done is we preserve them in these media, Macquarie-Kaufman and the Optisol, the Dexol and the K-sol media.
Okay, and the operation is also simple once for transplantation?
Yes, the operation is also simple. Yeah.
Okay.
We just remove the diseased cornea completely as a whole, and then we transplant the corneal cell rim that has been taken from the donor, and we suture the new recipient cornea into the eye.
Okay, and suppose suppose I am your patient and I need a transplant. It is you who will help it out, or how do the patient go about it? Suppose you detect it and you are telling me that yes, I need a transplant. Then how is the whole thing?
Yes. Actually, the doctors do help out. The doctors will contact, suppose if a patient comes to me having these corneal disorders, having suffering because of this corneal blindness. So the treating doctors will contact the eye bank in order to receive the tissues, because once I've contacted the eye bank will distribute the tissues towards the registered hospitals, the transplant hospitals. Then I can.
So it has to. Then I have to go to a registered hospital. Otherwise, it will not. Now, suppose means they're transplanting to a registered hospital. No?
Yeah.
So my admission also has to be guided to a registered hospital by the doctor concerned whom I'm consulting, right?
Yes.
And how do you find? Is it just for our listeners? That how do you find the procedure? Is it quite easy, or is
the procedure of corneal transplant, or the
the procedure of this contact? I need.
It's very, very simple. There's no need for the patient who's actually suffering from this blindness. Nothing needs to be done from his point of view. Everything will be done by the medical
doctors,
professionals.
Yes. So they are the ones who will be linking on.
Yes.
So actually, you all play a very big role in the life of these people. So I think our listeners, when we are listening to it, I think we need to do a lot of support to your people, because the person who's suffering is not going here and there to hunting for it, like what we hear as regards kidney transplant and this and that.
Yeah, you don't
we
need to hunt for your organ.
This is something we hear so much. People get put up, they are frightened and then wait for months or somewhere else for liver, this and that. But in case of cornea, it is not. So I think we need to encourage more regarding this pledge. Can this corneal tissue, which you said already, that if it is not up to the mark and they have some problem, you're using it for the students. The students can use it in a first hand. Only that, and for any other use, it cannot be used. No, but that is also a big thing. No, I think.
Yes.
Regarding the school and college awareness, ma'am, do you all have anything from your end where you all come and highlight this act to the schools or the colleges, because for their awareness, means whom can the schools contact, whom can the colleges contact, or the NGOs contact, where a real insight can be given to these people and raise that urge, raise that that feeling that my eyes can give light to someone else.
So when it comes to the role of the students, the colleges, they can organize these health camps, and expert talks. So for these expert talks, here comes the role of doctors. They can directly contact any hospital, local hospital that you would want an expert talk from. And it's a very simple procedure. Once you've contacted the hospital administration will get in contact with us, and there's no barrier for that. We can actually just
so it is through via hospitals.
Yes.
Because you all are working under, but you all also have an association, no, ma'am. So from there, your end, you all cannot come to the schools, because I'm quite eager about it. Because if there are so many people, but of course I do understand, as regards cataract problem, then there is no solution to it. Means only for corneal problem you can go for transplant.
Cataract, we go for cataract surgery.
Just that. Yeah. So it's only that with the corneal we can have a transplant. For any other, we can have any transplant for eyes?
No, it's just the cornea.
So you have to have that problem, otherwise.
Yes.
So what in outside? What do you say? All over India, what is the ratio you see? The amount of this problem. Otherwise, why is this not put in so much of pressure that everyone should pledge for it?
Actually, this problem arises mainly in the northeastern states because of lack of these eye banks. As I've seen in the southern parts of India, the western parts, northern parts, actually a lot of people are coming up with... Actually, we were burdened when I was working in Maharashtra. I was burdened with the eye donations because we were just busy. Every day we were getting 5-6 calls from the people.
But what I want to say, doctor, is the need also equivalent?
Yes.
Or is it just that...
No. The need is also very much equivalent to it.
Or to what is coming.
Yes.
Okay. So it's only this part. We need to work on it, and we'll do miracles, I think. One day we are not going to be behind, but we are going to be at the forefront.
Yes.
Keeping in mind with this topic, last but not the least, doctor, what would you suggest or what would you say to our people, to the listeners who are listening to this program today?
So finally, I would like to urge the listeners who are listening today to make a profound impact by pledging your eyes today, so that you can gift to others who cannot see this gift of light, because this gift is a very noble act, and it's life-changing for that person who receives. And to please eliminate all these cultural barriers, the social norms that you have, the religious barriers that you have regarding eye donation, as I've just cleared up a while back. This eye donation, according to me, is also like a gift of immortality, because your eyes can see the beauty of this world through another person's eyes long after you're gone. So, according to me, that is something very special.
Well, as we come to the end of today's special program, National Eye Donation Fortnight, perhaps there is one thought we can carry with us. Our lives may have an ending, but the good we do does not have an end with us. A decision to donate our eyes is a decision that carry light forward. It can help another person experience the colors of the world, recognize the faces, the love regain, independence, look towards a future filled with possibilities. And perhaps this is the most beautiful thing about giving the gift. Does not diminish the giver. Instead, it becomes a part of someone else's story. So let us not allow eye donation to remain merely a subject we hear about during an awareness fortnight. Let us look about it with our families. Let us talk about it with our families. Let us learn facts. Let us replace myths with understanding. And where possible, let us consider making the gift of sight a passion of our legacy. Because sometimes the brightest light we have left behind, or the brightest light we have behind, is the light we help someone else see. With that beautiful thought, we bring today's special program to a close. And I think it will be a wrong on my part if I don't thank Dr. Phinrikerbha. Thank you, Doctor, for clearing so many doubts for the listeners and for me especially. Thank you for giving us this time and for being with us. Until we meet again, keep spreading awareness, compassion, and, of course, remembrance. Give sight, give hope, give someone a chance to see the world. Thank you, Doctor.
Yes, it's my pleasure.